All right, let's get right into it. So, you have diabetes, and the topic of cataract surgery has come up. I get it. That can bring up a lot of questions. Because this isn't just about fixing a cloudy lens, right? It's about handling a pretty common procedure when you've got a few extra variables in the mix. Today, we're going to break down exactly what that means for you.
Ha, does that sound familiar? I mean, it is so easy to get caught up in the logistics, where to park, who's driving you home, and you completely forget to ask about the single most important factor in the room, your diabetes. That feeling of being a little unprepared, that's exactly what we're going to fix today.
So let's start with the big why. Why does this whole thing feel so different? Because frankly, when you have diabetes, this surgery is not just a standard tune-up for your eyes. The entire game plan changes.
And this slide really nails the difference. For most people, cataract surgery is a quick, in-and-out procedure, a shiny new lens and you're back to life. But for someone with diabetes, it is a delicate balancing act. Why? Well, because any surgery, even a simple one, causes inflammation. And in an eye that's already dealing with the challenges of diabetes, that inflammation can really stir things up, especially for the retina, that super important light-sensitive tissue at the very back of your eye. And look, the stakes feel higher because they are higher. People with diabetes often get cataracts earlier in life, and they tend to get worse faster. This means the surgery often happens when you're right in the middle of everything. You're still working, driving, taking care of your family. But here's the most crucial part. The cataract, the cloudy lens, that's the obvious problem. The real challenge, the thing we have to pay attention to, is the health of the retina that's hiding right behind it.
Okay, so let's peek under the surface and talk about those specific risks. Because honestly, knowing what you're up against is the absolute first step in protecting your vision for the long run.
First up, we've got diabetic retinopathy. The easiest way to think about this is to imagine the tiny blood vessels in your retina as a network of delicate little pipes. Diabetes can make those pipes weak and leaky, and when they leak, it messes with the retina's ability to do its job, which is to capture light and send crystal clear images to your brain. Now, when those leaky pipes start dripping fluid into a very specific, very important part of the retina, called the macula, you get what's called diabetic macular edema, or DME. The macula is your high-definition camera. It's what you use for sharp central vision, for reading a book or seeing a friend's face across the room. Any swelling there can cause some serious blurriness and distortion.
And here's where it all connects. The surgery itself, which, remember, always causes some inflammation, can actually provoke these conditions. It can trigger that macular edema or make existing retinopathy worse. On top of that, healing can be a bit slower and there's a slightly higher risk of infection. All this can lead to what doctors sometimes call vision disappointment. It's where the new lens is technically perfect, but the retina behind it just isn't healthy enough to give you that sharp image you were hoping for.
And this quote just says it all, doesn't it? This isn't just some vague advice. The science is clear. There is a direct link. Getting your blood sugar under solid control before you go into surgery gives your eye a much better shot at a smooth recovery, without that nasty complication of post-op swelling.
Now, I know this might all sound a little intimidating, but this is where we totally shift gears. Because you are not just a passive patient along for the ride. It is time for you to become the CEO of your own surgery. Yep, that's your new job title. Think about it. A project manager doesn't just show up on launch day and hope for the best. No way. They coordinate all the teams, they check the foundation, they manage the timeline, and they are not afraid to ask the tough questions. From now on, that's your job.
Because this really is a team sport. You've got your cataract surgeon, you've probably got a retina specialist, and of course your primary doctor or endocrinologist who manages your diabetes. They're all on your team. And you, as the project manager, are the crucial person who makes sure they're all talking to each other.
Okay, so every good project manager needs an action plan. This next part is your toolkit, everything you need to prepare like a pro and avoid those common pitfalls. We can really boil this down to 3 critical pre-op checks. Number 1, vet your retina's health. Is the foundation solid enough to build on? Number 2, get a clear written medication plan. Fasting before surgery and managing insulin can get tricky without crystal clear instructions. And 3, get a real cost estimate. Make sure you understand exactly what's covered and what's not, so there are no surprises later. So, to get the answers for those checks, you need the right questions. Think of this next slide as your script. You are interviewing this team for a very important job. Here they are. Don't be shy about asking these. Start with, how healthy is my retina right now today? Then, based on my eye, what is my personal risk of developing macular edema? And a big one, looking at my A1C, is this really the best time for surgery? Make sure you know how they plan to coordinate with your diabetes care team. And when it comes to the new lens, ask which lens is best for my eye and my lifestyle, not just the newest or most expensive one. And finally, maybe the most practical question of all, who do I call at 10 o'clock on a Saturday night if something feels off?
So, the surgery is over. Success. But the project is not done. It's just entering a new phase. Recovery is where the real work of protecting that brand new vision truly begins. This quote is just a perfect illustration of why you have to stay vigilant. This person's surgery was a success. Everything went beautifully. But a few weeks later, they noticed this weird, subtle bend in the straight line of a countertop. That was their retina, quietly freaking out, as they put it. It was the first sign of swelling, and because they caught it, they knew to call the doctor right away.
So you can really think of this whole thing in 3 simple phases. Before surgery, it's all about prep work, checking the retina, getting your glucose stable, and getting all your plans in order. On surgery day, it's all about execution, following those fasting and medication rules to the letter. And after surgery, it's about monitoring, using your eye drops religiously, watching for any changes like that bent line, and please never ever skip a follow-up appointment.
And that is really the bottom line here. Removing that cloudy cataract is a huge quality of life improvement, no doubt. But it does not cure diabetic eye disease. Lifelong, regular monitoring is still absolutely the key to protecting your eyesight for years and years to come.
So after all of this, after all this information, what do you think is the single most powerful tool you can bring with you to your cataract surgery? It's not a special kind of medication, it's not some new technology. It's your list of questions. That's it. Your questions turn that vague sense of anxiety into a clear, concrete action plan. They make sure you are the project manager, not just the patient. They protect your vision, and they protect your wallet. Truly, the most important thing you can bring into that doctor's office is your own curiosity.